Hello everybody, I'm Karchu together with Cyril Aldas, Abby Lapid, Angelic David, Faye Omar, and Christian C. So we are third year BSPT student from Our Lady of Fatima University, Valenzuela campus. And today we are with our special guest, Sir Noel, who's a PTRP from La Union and have experience in community-based rehabilitation, which would be our topic for today's interview. First of all, thank you, sir, for joining us today to share with us your knowledge and experiences in community-based rehabilitation.
You're welcome.
So for the first question, sir, we have for you is, sir, can you introduce yourself and tell us a little bit about you?
So I'm Noel Oribio, PTRP. I graduated 1999 from Lorma Colleges. I passed the board exam on the same year, August 1999 yun siya. So right now, I co-own a physical therapy and wellness clinic in San Fernando City, La Union. I also have a satellite clinic in Urdaneta City, Pangasinan. So my practice is actually manual manipulative physical therapy, but I also practice general PT. So may mga stroke patients din kami. When I started my career, nagturo ako. I taught at Lorma Colleges 1999 to 2002. And then I went to full-time mission for my church. And then I came back for another year of teaching. Noong 2006, I transferred to Lorma Medical Center. So PT staff for 7 years. So 2013, if I'm not mistaken. So I resigned from full-time employment and I did my own thing. So I did clinics, private clinics na dati. And I also tried my luck with CBR kasi ang unang effort namin with CBR sa barangay lang namin. So I teamed up with a physical therapist and an occupational therapist, and we provided pro bono physical therapy and occupational therapy services sa special children. So yun yung 2013. So fast forward to 2018, I was contacted by a high school friend na siya yung head ng social welfare and development sa municipality of Naguilian, La Union. And parang ano kami dun job order. So they give us remuneration for some of our time that we provide treatments for special children. But it's actually a CBRP, a Community-Based Rehabilitation Program. So after I do my clinics Tuesdays, Thursdays, and Saturdays, so private clinic ko yun, I go to Naguilian for my CBR, mostly Mondays and Fridays. Tapos yung OT naman, may sarili naman din siyang job order doon, so he comes to the CBR Wednesdays and Fridays. Ganun. And then I do my Urdaneta Satellite Clinic Wednesdays and Sundays. So ganun, medyo hectic yung trabaho. So I'm really sorry for the past 2 schedules na hindi tayo natuloy. So every day is a day to serve our fellow men, no? Yung mga kasama natin na may mga persons with disabilities. So ang background ko is really for most of my time since 1999, clinics, private clinics, and then I had experience with faculty, tapos community-based, and tertiary sa hospital-based PT din. Yun. So medyo mahaba pa rin yung So if you want my full bio, I have it on LinkedIn, at LinkedIn. So naka-post naman yung bio ko doon.
Okay, for the next question po, Christian C.
What Daliton? What you pursue GPR? How long have you been on GPR work?
It's been like 2 years full for the community-based rehabilitation in Naguilian, La Union. But with my private efforts as a PT, the CBR in my area has been like since 2013. So I'm doing 2 CBR programs now. One CBR is really at the grassroots level in my barangay, and then the other one is a full-time or full program in cooperation with local government unit. So I do private and I do government. So it's like But for the most part, it's really 2 years. 2 years full-time program for community-based rehabilitation.
Sir, for follow-up question lang po, bakit po ang CBR yung napili niyo pong field of work for PT?
I guess it's not really a choice. So it's been like after I finished my job as a full-time PT staff from Norma Medical Center, we thought of something to do full-time before we really push for private clinics. So before we ventured into the business of physical therapy, what we did is we focused on pro bono, parang charity. So we had our time working at the hospital, at the colleges for teaching. So we tried what can we do in the barangay level for our time kasi ang dami na naming free time. So when we resigned, I resigned because my two other colleagues were still employed back then. So I had so much time to spend, and if we start full time with the clinics, we won't be having much private patients really. So we check on the barangay, what can we do to help? So we identified like 5. We started with 5 special children with cerebral palsy, with post-meningitis, mga conditions nila. And then there were also 2 other stroke patients who came to our center. So we used my grandparents' old house, yung family house, as our center for the community-based in rehab in Bawang. So it's my hometown, but we're really focused on our barangay in Kalumbaya. So parang ano na lang siya, it's a byproduct of our. It's not really we're focusing on CBR. What we were focusing on is how we can serve at the barangay level without expecting anything in return. That's how I started with CBR.
Okay po, sir. Thank you po. For next question na po.
Good morning, sir.
Good morning.
For the next question, sir, what are the organizations, VMO, current projects, and current partners po?
Actually, hindi pa rin malinaw yung vision and mission. As stated by the LGU. So I guess we still prescribe to the national PWD vision and mission of helping individuals being productive and being part of society, of building the society. It's like empowering persons with disabilities to be part of nation building. But I haven't seen any document yet with the local government unit na nag-spell out with all the statements of the vision and the mission. But what we're doing right now, with all the aspects of CBR, from health promotion, education, rehabilitation, assistive devices. So we're really focused on the rehabilitation part. Since ang pinaka full-time manpower is 1 physical therapist, that's myself, and 1 occupational therapist, my colleague, Sir Lawrence. So we've been focusing on the part of rehabilitation for now. And of course, health education with the parents and the carers. But we really need more effort on health promotion and the other parts, even assistive devices and other parts of CBR. The main organization that is helping with the program, or the one who is really pushing for the program, is the Municipal Social Welfare and Development Office. So MSWDO of the local government unit of La Union. We also have other donors like Shriners Philippines. So they provide the wheelchairs. Sometimes they come to the clinic. So they travel from Manila. So they come to Nagilian. We are also in contact with PCSO, Philippine Charity Sweepstakes Office. So this was before the pandemic. Na? So mga January, February. When March came, nag-stop lahat. So even our attendance from majority of our clients, mga special children, they won't come for rehab. Luckily, we still have like mga 5 na active ngayon. So yung total population namin for the active people who are coming to CBRP now previously was 20. So we have around 20 patients, and it dropped to 5. sometimes there are 3 ganon in a month. So we have 3 times a week na schedules for sessions, therapy sessions. So yun yung organizations na tumutulong din sa amin. I tried to get in contact with my co-physical therapists from Lorma colleges, and there were like 2 or 3 volunteers who also come to our center. So they give like 4 hours to like 8 hours each week. Okay na yun. So we accept them to give their time for community-based rehabilitation in Nagilian, La Union. So it comes from individual healthcare professionals, mga PTs, also from the government sector and the private sector. So tulungan.
Follow-up question lang po.
Okay.
Are there any specific other organizations na tina-target po ng CBR nyo?
It's really the PWD organization. So in the LGU, the local government unit of municipality of Nagilian, La Union. So most of the efforts, even the support system that we have, are from the PWD organization of Nagilian, La Union. The MSWDO pushed for the program. Wala kaming building na pupuntahan, wala kaming clinic. So they asked for help from the Department of Education. So they teamed up and they provided a room for us at the Special Education Center. So yung current na office namin in Nagilian, La Union is at the Special Education Building or Center of Nagilian. So bakit? The PWDs, the children with special needs, most of them, majority of them are also enrolled with special education. So when they do their classes at the SPED, they also have their sessions with us at the CBR, Community-Based Rehab.
Thank you, sir.
Okay.
Sir, for the next question po, describe the status of the person with disabilities in the CBR conducted po.
Functional status or economic status, mostly are indigent. So they come from very poor families. So mostly mga mother, father, tapos may 2 o 3 anak. So mga ganon. Children with disabilities as young as 1 year old and as old as I think we have now 25 special persons, and we also have geriatric patients, mga stroke survivors, so like 60s, 70s, like that. So functional status, most of the cerebral palsy patients are may mga bedridden pa din, may mga wheelchair borne, meron ding ambulatory. They are also walking. So for the past 2 years, we've seen functional improvements with our clients, especially the special children who were not able to stand and walk before. For 2 years, mag-focus kami for standing and walking, and they can now walk with pediatric walkers, or they can manipulate their wheelchair, pediatric wheelchair. So, ganon.
So, thank you po, sir. Sir, what are the common challenges po that you encounter in conducting CBR programs, and how do you deal with them po?
Number 1 is the willingness of the carers or the parents to assist their children or their family member to come for therapy. Right now, we are not yet equipped to provide services at the home of the clients, but we're trying to educate the parents and the carers to provide the home exercise program at home. The problem is there are like a significant number of carers who are not really supportive. So sometimes yung kapitbahay, the neighbor of the person with special or the special child, would be the one to bring the child to the center, because the mother, the father, or the siblings are busy with something, probably work or school. So sometimes the children with special needs and others, like I have a 25 years old nurse right now, licensed nurse. He used to work in Saudi, and then he had diabetes, and then he had a stroke abroad. So they had to bring him home. So that was 3 years ago. So right now he's not productive. So he needs a lot of assistance with activities of daily living. So the breadwinner is the mother. So the father is also a stroke survivor. So the siblings do not really care about their brother, yung sibling nila. So the very big challenge now, the primary challenge, is how we can motivate or probably to give inspiration or guidance to these family members on how they can support their family members with special needs. So how do we go on with that? So we hold support groups. No? So we ask other parents who are really motivated with CBR. So how can we encourage them to bring their loved ones for rehabilitation, and how they can, probably the other parents or carers, no, would visit the home of this challenged family. No? So most of them are indigent, so they really need to work for a living. So sometimes the needs of the child or the person with disability are not really the primary concern of the family. It's really how they can survive on a daily basis. So one of the concerns, or one of the principles of community-based rehabilitation, is how we can help families become sufficient. So we can work with vocational counselors, we can work with the social welfare, so they can also assist these families on their income generation. So how they can boost their income for their family's needs. And there are a lot more challenges. So that's a primary challenge, I guess.
Okay, sir. For the next question naman po is, how do you coordinate your projects to the private and government sectors po?
Right now, we are our boss, no, yung nagpo-push for the program is really the local government unit, and our direct supervisor is the MSWDO, the Social Welfare and Development Officer, who was my high school classmate, no, Miss Wilhelmia. So we provide monthly progress reports per client, and then we also provide accomplishment report, I mean, for the whole program, and progress report for each client. So we have not much efforts yet reaching out to organizations from the private sector. Um, I guess it's not really my line of my work, no, because as a job order, naka-specify yung job that I need to do on the 2 to 3 times a week basis. So clinic-based pa lang, kulang na kulang kami. So the only thing that I can push for is to accept volunteers in the program. No? So parang private individuals who come into the community-based rehabilitation and provide healthcare services. So that's how we coordinate for now. We had an organization before, the La Union Physical Therapy Society, but majority of our members went abroad. So na brain drain na yung area namin. So we are pushing for new graduates and new licensed PTs and other healthcare professionals and PWD advocates who would want to share with our work in the CBR. We also are because I'm also the coach for MATP, Motor Activity Training Program, for Special Olympics Philippines. So we are also coordinating with Special Olympics. So the program for the grassroots level, the individuals with very low competencies, is Motor Activity Training Program. So it's really in line with motor development for our special persons. So I guess yun muna. So we do with Special Olympics. Of course, if you say Special Olympics, what we're thinking of is competition. So it's not really competition. For persons with disabilities, it's really for integration or inclusion, how they can be included, how can they participate in sports-related activities towards motor development and skills in ADLs.
Okay, sir. Thank you po. For the next question naman po is, from your observation po, what do you think is the difference between working as a CBR PT and the difference from working in a hospital or clinic po?
In a CBR setting, your focus is not only the person that you're providing services. Like if you're a PT, I'm doing physical therapy management for a client, but I'm also focusing on the other people in the community. So you need to be able to communicate what you need to promote, the health education and health promotion aspect of what you're doing to the community. So even the barangay officials, for example, so if you are in an area that you need to promote the program, so how can you encourage other people by having them understand what CBRP is all about? So you really need to get on your knees, literally, to have them understand that we are here to help you. In a hospital setting, you don't really care about other aspects except for focusing on your client and probably giving the home exercise program and following up if they really do it at home. So I guess ano there's a big part of our work with CBR is having the heart to do what is needed, what is necessary. So of course you still have a heart at the hospital, but you really have to, it's a hospital-based PT is really working at a more professional level. Um, the the competencies of a PT at a hospital-based setting is much more defined compared to working at the CBR. So when I work with even vocational counselors and with we also have a psychologist who is the SPED teacher actually. So he also provides psychology services. I mean encouraging the families and the individuals who go to CBR. So you need to understand. It's more of in a hospital setting probably it's an interdisciplinary. So your work as a PT is cut out for you. So you only do this as a PT. You don't do the job of the OT. You don't do the job of the psychologist and stuff like that. But if you are at the CBR, you don't really have a choice but to do all the other job. It's transdisciplinary. So you have to understand what the OT is doing, and then you can actually butt in during the session. And even when you are working with a social worker, when you go out and check on families, you need to also understand the skills that you need to have, even if you're not a social worker, because you are a CBR practitioner. So community-based rehabilitation practitioners are not exclusively physical therapists, not exclusively occupational therapists. So you are a well-rounded person as a CBR practitioner.
Okay po, sir. Last naman po is, how do you manage your time po as a CBR PT and at the same time operating your own clinic po?
Schedule lang. So we need to schedule. So Tuesdays, Thursdays, Saturdays, I really need to focus on my private patients. Mondays and Fridays, I have to focus on community-based. Wednesdays and Sundays, I need to travel to the other clinic. So you need to stick to your schedule. Sometimes private clients are, because they pay your time very well. So they would ask if you have other days, and you would have to be firm and follow your schedule. So just follow your schedule. So you should have a planner. So I have a planner every year. So medyo magulo pa rin siya. So every hour that you spend with a person counts. So in CBR, so at the height of our CBRP efforts, we had like 20 clients coming in every day. And then you only have 1 or 2 volunteers. Sometimes you don't have volunteers, so you have to do it on your own. So how can you do that in a day? So 20 clients a day, that's too much. So you have to manage your time. So you have to also be very creative. So in CBR, compared with hospital-based na you have to go through like electrical stimulation, exercises, no? Superficial heating, deep heating. In community-based, identify your goal. So for example, skill nung bata to push the hand, yung mag-shoot lang ng bola. So if you want to integrate sports, then you focus on one skill. So you don't need to target all the goals in one session if you have 20 patients. So time management pa din.
So, sir, what are your future career goals po in promoting the CBR in our profession po?
Ayun, so I've in contact also with a classmate, batch 1999, si Miss Christie. So she made a study for her master's in arts and science education. So she did a study on barangay health workers in one municipality in La Union, and she identified the skills needed by the BHWs to provide CBRP. So because we lack manpower in community-based rehab, and we cannot depend on all physical therapists to go on CBR, so we need to look for people in the community. So right now, persons who work in the community for healthcare are the barangay health workers, or CHW, community health workers. So if we can identify their needs, what skills they need to learn when it comes to CBR, and then we provide the training for them, or we can even train trainers to do the work, then we can, multiply our efforts with community-based rehabilitation. Right now, wala pa kaming ganon. So we are not in Nagilian, La Union, so we are not coordinating yet with the Department of Health, with the barangay health workers. We are coordinating with the social welfare. So I guess our focus would still be the organization of PWDs, the PWD organization. So we will try to continually train people from the organization, local organization of persons with disabilities, that they may provide some of the services with CBR besides rehabilitation.
So, as you said, sir, your future focus. So, sir, we want to know what is the main focus of your CBR programs in the past and in current po.
Before my time with Nagilian, La Union, they used to have STAC, Stimulation and Therapeutic Activity Center, and then the PTs went abroad. So their services were stopped for like close to 10 years, 8 years yata, na there were no physical therapists who came to the area. So there was no clear-cut program for CBR in the past. So we are just starting. In the entire province of La Union, I can only think of one CBR initiative in the city of San Fernando. I'm not sure if it's still functional because the PT also went abroad already. So, and then Nagilian. So we're very proud that we have a CBR in La Union. No? The Nagilian LGU is a small local government. It's a very small. It's on the way to Baguio City along Nagilian Road. So I cannot answer for their efforts in the past, no. But for the past 2 years, we've been really working on having parents and carers of persons with disabilities help us with our efforts to really solidify what the program is all about. So with the MWF Monday, Wednesday, Friday schedule, we hope to push for a daily schedule soon. And if the LGU can assist us with getting one full-time CBR practitioner, or maybe they can assign somebody from social welfare who really would have to coordinate all the efforts for CBR. Because right now, as the healthcare professionals, the PT and the OT, our main objective is really on the rehabilitation part of CBR. So we haven't touched yet on health promotion and even on assistive devices in their homes. So kulang na kulang. So we lack manpower. The funding is really for the center, not really for the whole program. So kulang pa yung funding niya. The funding for the Nagilian CBR is from the Gender and Development Fund. So GAD fund of the LGU. I'm not sure how they can tap on resources or funding from the uh, for persons with disabilities. Kasi may disability funding din for local government. So they really need political will in areas with CBR, especially the Sangguniang Bayan if it's municipality-based CBR, and they would push for resolutions for funding of the programs.
So for the next question, sir, is what is the overall impact of this program to the targeted individuals?
Okay, so in all cases of CBR clients, our main goal would be to help them become independent and become productive. So sa mga special children who were bedridden, so ang goal is to have them sit up, and those who can sit up would actually stand and then walk. So with lesser supervision from their parents, so their parents can do their job, and the children can proceed with schooling, with this special education. So they would go on with life. So they would achieve their family goals. How can they get educated? How can they get functional within the home, within the community? So that is the overall impact really, to having people or having persons with disabilities get the help that they need besides health services. Okay, and then they would also improve the productivity of their families. So I'm shooting for a bigger vision right now. So because right now physical therapists, if you say CBR with PT, what comes to mind is PT services in the barangay level. So that's our focus probably. So what we do as PTs, and you go to the either the home of the person with disability or the CBR center. But CBR is a much bigger thing than just physical therapy services.
So for the next question po is, as a physical therapist po, what should be the qualities that they must have in pursuing CPR as a work po?
Qualities, patience, number one. So the patience to go on despite challenges, tapos self-motivated. So you know what you want, and even if you don't know how to get it, no, you are self-motivated to get after what you want. So if you are really pushing for work in the communities, remember CBR is the first word is community, so community-based. The problem with physical therapy is, that's really a problem. The challenge with physical therapists right now is that our training, part of my training in 1999, is really focused on going abroad. So the skills that we get from our curriculum is really for the work abroad. So how we can do physical therapy at a tertiary hospital, but not really geared towards staying in the Philippines. But right now with the CBR program integrated into the physical therapy curriculum, I hope people would stay in the Philippines. So, and also, what other qualities? I guess that's it. Patience and self-motivation. So if you're in a hospital setting, you need patience for 1 hour. That's it, and then you stop with your patient. You go for a break, and then you return for another patient. In CBR, that doesn't happen. So for the whole day that you are in the center and that you're doing work, you are faced with clients, caregivers, parents. So you have to deal with everybody. So even people from your organization, so from the social welfare, or people from the private organizations who come to the center and check what you're doing. So you have to have you don't need to be outgoing, no? Hindi kailangan na extroverted lagi. But you have to be able to communicate, na a good communicator, ang number one. So you need to communicate what needs to be done, and what the needs of your program are to your organization and to other organizations as well. So yun, patience, self-motivation, and then good communication skills.
So, next question, sir, is any advice po that you can give to aspiring physical therapists that wanted to pursue CBR work?
I guess my advice would be to all physical therapists in general muna. So after your licensure, don't be afraid to work. No, whatever work na PT related, just go for it. I was just lucky, I guess, na when I graduated in 1999, they needed additional staff, no, kahit hindi ko patapos yung masters ko. They accepted me to teach, no, without any experience. And then I transferred to the hospital. So however small the income is, no, you really have to work. So when you work, you will develop the professional skills and competencies that you need to do CBR and other physical therapy stuff. So I haven't heard of a PT yet who would say, oh, my goal is to become a CBR PT. Wala pa. So incidental, no? People in the CBR field is really not, they did not envision themselves to be CBR PTs. So ganun lang, parang nangyari na lang. But when I was a student myself, no, we had a community-based rehab, pero not like you that you have a whole subject for it. So it's just like incorporated in our internship. So you have 1 or 2 months of community-based rehab, and it's really a PT clinic in the barangay. That's it. So it's not really spelled out what are the goals of community-based rehab. You just go to the barangay and you do physical therapy. So I guess, sabi ko, what's the difference between a CBR PT? It's the same thing that we do at the hospital, except that we don't have much resources. So black box pa dati gamit namin, no? So we bring the black box, our own thing, our own exercise materials. So we improvise our tools. So ganon. So kung walang parallel bars, we ask the persons in the barangay to make a bamboo parallel bar for us doon sa likod ng barangay hall, so we can do gait ambulation training or standing training for PWDs. Ganun. So do the job. So after your graduation and after your licensure, so get a job related to physical therapy. And then if your heart is into community-based rehabilitation, go for it. So walang problema. So we can have our time with CBR and then we can move on, no? So of course our motivations would, right now we have the Doctor of Physical Therapy program in the States, and I guess in the Philippines as well, no? So ang magiging focus na natin in the coming in the near future is really finishing our Doctor of Physical Therapy. So I am not sure if there would be people with Doctor of Physical Therapy who would go on CBR PT in the future.
Okay, so that's it, Sir Noel. We are done with our interview questions, and
Okay.
thank you so much for your advice to those physical therapists who wanted to pursue physical therapy in a CBR. And before we end our virtual meeting po, we would like to present our certificate of appreciation for being our guest in today's meeting and for your active participation in sharing your knowledge and experience about physical therapy in CBR po.
Thank you very much.
Okay, sir. So, senda lang po namin siya sa'yo. And, sir, so the copy of video din po, sir. And, sir, can we request po ng picture?
Okay.
Okay, sino pwede mag-screenshot? Wala na lang po.
Ako na.
Okay, sir. Okay, sir. 1, 2, 3 po. Ready na po. Okay na po, sir.
Okay.
Thank you. Thank you so much, sir.
Thank you po.
You're welcome.
Thank
Good luck
you,
sa inyong
sir.
lahat. Good luck sa inyong lahat. You can do a great job in physical therapy talaga. So don't lose the vision. No, you will be physical therapists. At I'm parang happy ako na makita na may mga nagpo-push pa rin for physical therapy kahit very challenging siya. Third year kayo, di ba? Third year?
Yes po, sir.
Okay.
Yes.
Very challenging naman ang third year pero it's the start of something big. So congratulations. So have a great day sa inyong lahat.
Thank you, sir.
Thank you
Bye-bye
po.
po.
God bless po.